I'm Ellison Ostrom, and I'm going to be performing the newborn assessment today. So I'm going to start by performing hand hygiene and making sure I have gloves on before beginning my assessment. So the first thing I notice is that the baby is pink, the extremities are flexed, and there's movement occurring bilaterally, which are all normal things. The next thing I'm going to note is there's some milia on the skin, which are just small white cysts that disappear within the first few weeks, and those are normal. There may also be a little bit of arrhythmia or stork bites, but I don't notice any on this baby. However, those are normal findings as well. The next thing I'm going to do is look at the baby's head, and the first thing I notice is that it's 1/4 the length of the baby's body. I'm next going to go ahead and measure the baby's head by lifting it slightly. And this baby's head is 34 centimeters in circumference. However, anything from 32 to 38 is considered normal. The next thing I'm going to do is palpate the baby's suture lines and fontanelles. So the suture lines are approximated, and the anterior fontanelle is diamond shaped and the posterior is triangular. If either of the fontanelles were sunken or flat, it would indicate dehydration, or if one of them was, or one or both of them was bulging, it would indicate increased intracranial pressure. But this baby's are normal. I'm also going to look for caduceum, which is just swelling at the crown secondary to pressure as the baby descends the birth canal, and it goes away on its own within 1 to 3 days. However, this baby has none. I'm also going to look for cephalohematoma, which is bleeding between the periosteum and bone that doesn't cross the suture lines, but this baby doesn't have any. The next thing I'm going to look at is the baby's eyes and note that they're grayish blue in color, and I'm going to go ahead and assess if they're perla. So this baby's pupils are perla and 5 millimeters. The next thing I'm going to do is look at where the top of the pinna lines up, and it should line up with the outer cannulus of the eye or slightly above, which it does, so this baby is considered normal. I'm also going to look for any preauricular skin tags, which could indicate renal malformation, but this baby has none. So that's considered normal. The next thing I'm going to do is check the nostrils for patency. I'm going to do this by blocking one nostril at a time while the mouth is closed and making sure the baby can breathe through the open nostril. So the left side's patent, and the right side is patent. The next thing I'm going to do is look at the baby's mouth and note if there's any circumoral cyanosis, which there's not. If there was circumoral cyanosis that increases with crying, it would indicate cardiovascular problems. However, as crying decreases, so should the cyanosis, since there's more oxygen being taken in. If this doesn't occur, it could indicate further problems. I'm also going to look for symmetry of the mouth to rule out facial nerve injury, which the mouth is symmetrical. The next thing I'm going to do is check the rooting reflex. I'm going to do this by touching one side of the baby's mouth, and the baby should turn to that side. And the other side. Alrighty, so those are good rooting reflexes. I'm also going to look and see if I notice any Ebstein's pearls, which are just small white cysts in the gums that disappear on their own within the first few weeks, but I don't notice any on this baby. The next thing I'm going to look at is the baby's neck, and it moves easily side to side. It has thick skin folds and is short, which are all normal findings. If there was any webbing or obvious fat pad, that would be considered abnormal. The next thing I'm going to do is palpate the baby's clavicles by running my finger over each clavicle. So this baby's feel normal. If I were to palpate any lumps, that could indicate fracture secondary to trauma, but I don't feel any. The next thing I note is that the chest is cylindrical, as it should be, and the nipples are slightly swollen due to maternal hormones, but that's considered normal. The next thing I'm going to do is measure the baby's chest right at the nipple line. So this baby's chest is 32 centimeters in circumference. However, anything from 30 to 36 is considered normal. So the next thing I'm going to do is check the baby's respiratory rate. I'm going to do this by observation by placing one hand on the baby's chest or abdomen, and I want to count for a full minute since baby's breathing can be irregular or have periods of apnea. Alrighty, So after counting for a full minute, this baby's respiratory rate is 40 breaths per minute. However, anything from 30 to 60 is considered normal. So if I were to notice any asymmetrical breathing, chest retraction, circumoral cyanosis, nasal flaring, increased respiratory rate, or grunting, that would indicate respiratory distress, but this baby shows none of those signs. I also want to be aware if this baby was born via C-section, there may be more fluid sounds in the lungs since they're not getting that push of fluid as they exit the birth canal. The next thing I want to do is listen to the baby's apical pulse, and I want to do this at the fourth intercostal space, left at the sternum, and I want to make sure to use a pediatric stethoscope to eliminate all other sounds such as vowel sounds. I want to make sure to listen for a full minute. Alrighty, so after listening for a full minute, the baby's apical pulse is 140 beats per minute. However, anything from 120 to 160 is considered normal. The next thing I want to do is go ahead and palpate the brachial pulses. So the brachial pulses are normal and regular bilaterally. Let me go ahead and palpate the femoral. And those are also normal and regular bilaterally. So we wouldn't routinely take the baby's blood pressure, but if we were to, it should be 65 to 95 systolic and 30 to 60 diastolic. The next thing I'm going to do is make sure to listen to the baby's bowel sounds before palpating the abdomen, and we should expect to hear bowel sounds a few hours after birth. So I'm going to go ahead and listen for a full minute in each quadrant, but for purposes of this video, I'm not going to do that. Alrighty, after listening for a full minute in each quadrant, since this baby's a few hours old, the bowel sounds are normal active. The next thing I'm going to do is inspect and palpate the abdomen and note that it's soft, round, and symmetrical as it should be. So when I look at the umbilical cord, there should be 2 arteries and a vein, however we may not be able to distinguish them. On this baby I can distinguish the 2 arteries and a vein. It's bluish white in color since this baby is only a few hours old, however it will darken with time. If I was to note any bulging, it would indicate an umbilical hernia, but this baby has no bulging. So the next thing I want to do is I want to go ahead and test the baby's Moro reflex, and I want to do this by startling the baby by lifting it slightly, and as the baby is allowed to fall, the arms should abduct, the fingers should fan and form a C position before resting at the baby's side. Alrighty, so that was a good Moro reflex. The arms abducted, the fingers fanned, and formed a C position before resting again at the baby's side. The next thing I'm going to do is look at the baby's hand and note if there's a Semania crease. Just one crease in one hand could indicate genetic problems. However, this baby doesn't have any, it has multiple creases. So the next thing I'm going to do is check the palmar reflex, which is where if I put my finger in the palms of the baby's hand, the baby should grasp my fingers, which it did, so that's considered normal. The next thing I want to do is check for hip dysplasia, and I want to do this by rotating the hips with the knees flexed and assessing for a positive Ortolani sign. That would be any noise like a clunk or a click as the femoral head is shifting or slipping in the acetabular. So I'm going to go ahead and test for that. Alrighty. So that's a negative Ortolani sign, and there was no indications of hip dysplasia. So the next thing I'm going to do is look at the baby's feet and notice that there's no club foot, no webbing or polydactyly. And I'm going to go ahead and test the baby's Babinski reflex. I want to do this by tracing my finger from the heel to the base of the toes, and the toes should hyperextend, which they do. Alrighty, so those are good Babinski reflexes, and the next thing I'm going to do A check for plantar reflexes. This occurs if I place my fingers at the base of the toes and the toes grasp my fingers, which they did, so those are good plantar reflexes. The next thing I want to do is look at the baby's genitalia. So if it was a female, the labia should be edematous, and there may be some bleeding or discharge due to maternal hormones. If this was a male baby, then we would want to make sure the testes are intact in the scrotum bilaterally and that there's no epistadius or hypostadius, which there's not. I'm going to go ahead and turn the baby over and check for anal fissures, which there are none. And I'm going to go ahead and note that the back is straight and flat and there's no indentation or tuft of hair. If there was, that would indicate spina bifida, but this baby has none, so that's normal. At the sacrum, I would want to note if there's any dippling, because that could indicate pilonial cyst or sinus, but there is none. I want to note if there's any Mongolian spots, which this baby has none. Those are more common in African American or Hispanic babies. And when I'm looking at the buttocks, I want to make sure that the skin folds are even bilaterally and that the legs are the same length, which they are. So that concludes my newborn assessment, and I'm going to swaddle the baby back up and return it to the position I found it. Thank you.